What is the largest challenge that you have faced at General and through your leadership at Meharry when treating the underinsured and uninsured?
Well, again, another excellent question. Our relationship with Nashville General Hospital is we are the primary provider of the clinical services, i.e. the physicians and the students who take care of the patients. The hospital is operated by the city and the county, Metropolitan-Davidson County, and we have a contractual relationship. So from a legal point of view, it's very important to understand that we are collaborators with the hospital. Now, one of the challenges we've had is in light of the fact that the hospital at times has had financial issues. We are concerned about that, obviously, because that's our home base. It's our platform to educate our students and to take care of patients. So that has been one of the biggest challenges, is that the negative press that has rolled out about the hospital at times doesn't truly reflect that this hospital is an excellent hospital. If you walk through the halls of the hospital, you are amazed at how beautiful the surroundings are. But more importantly, the care you get in the hospital is excellent. And don't take my word for it. Look at all the quality indicators that all hospitals have to report. And Nashville General Hospital exceeds the national average in many of them. So sometimes folks in the community can sometimes draw the inaccurate conclusion that because a facility is a public facility or operated by the government, it's second rate. Well, I can assure you, Nashville General Hospital is not second rate. And from my point of view, we're proud of the fact that it's our hospital, and we think we contribute to the fact that it's not second rate, because it's our doctors who take care of the patients, and it's our doctors who are measured in those objective quality assessments that come out from the hospital.
What do you think that Nashville, both government and then also within the private sector businesses, can help both Meharry and General Hospital to meet some of these challenges, or to help correct some of the issues that they faced in the past?
Well, again, another excellent question. Again, my view is, first of all, we have to understand that the hospital is a jewel in a crown. And to the extent that we understand that within the panoply of healthcare facilities that we're blessed with in this city, in this region, Nashville General Hospital is a key contributor. It does $60 million worth of uncompensated care a year. Between Nashville General Hospital and Vanderbilt, is almost $200 million of uncompensated care. That's more than the other 8 hospitals in the region, just 2. So if you were to wipe out Nashville General Hospital from the scene, it would be a tremendous burden on the other hospitals to pick up the indigent care burden. You know, one of the other things I often tell our students, sometimes we have this notion that the uninsured are totally destitute, that they're sleeping under I-40 every night. That's not true. You drive through McDonald's drive-through today, or Starbucks, and you order a $6 coffee. The likelihood that that young man or woman who serves you has health insurance is not all that great. These people get up every day, work hard, serving us coffee and hamburgers and so forth, but one of the problems is, if it's offered, it may be too expensive, health insurance, or they can't afford it themselves, plus their 2 kids or their significant other. So I think part of understanding is that we are taking care of people who are very productive, many who go to work, who have houses, who have cars, who have kids to educate, but for some reason they just don't have insurance. And we're hopeful that with national health care reform prospects under President Obama and the new Congress, that some of that will go away. But even if every person had health insurance, there would still be a need for Nashville General Hospital.
What are the largest misconceptions about treatment of the underinsured and uninsured, and what is being done at General to help set that record straight?
Well, again, the biggest misconception is the quality. And the quality of the hospital is terrific compared to national standards. So I think that's one thing I'd love to disabuse the emerging leaders of Nashville, that this is a poor quality hospital. The data are strongly in opposition to that supposition. Secondly, you know, there may be a concern, well, why do we always need to, why does the city need to throw resources at the hospital? Well, it's a community investment, and we have to look upon Nashville General Hospital as a community investment. For example, I've articulated since coming here and wrote an op-ed piece in the Tennessean that this metropolitan area is way too big and growing way too fast to have only one trauma center, and that's Vanderbilt. There ought to be, in my view, a second trauma center for this community at Nashville General Hospital. We have the helipad, we have the emergency room, we just don't have the resources to move it to the next level to say that we're an official American College of Surgeons Level 2 trauma center. So you say, well, what's the big deal about that, Dr. Riley? Well, if your loved one is traveling on I-40 north of Nashville and, God forbid, gets into an automobile accident, there's some significant trauma. Right now, ambulance would have to pass up Nashville General Hospital, take you to Vanderbilt emergency room, which is level 1. But we know that level 1, that emergency room at Vanderbilt is chronically crowded. They're on diversion. Sometimes they have to send patients to Kentucky because they're so crowded. Well, you got a platform right here at Nashville General Hospital, which just by having a level 2 could decompress the emergency room over at Vanderbilt. But more importantly, it provides an option for our citizens who may find themselves in some unfortunate trauma situation, whether it's a gunshot wound or a little old lady falling off a ladder and fracturing her hip, or, you know, a motor vehicle accident on one of our freeways. Right now we're pressed pretty thin, not to mention pandemic flu issues, because if we were to have the mother of all outbreaks with pandemic flu or other infectious diseases, you have to have facilities that know how to manage and take care of that. Right now, technically, there's only one in the community. So disaster preparedness, if we would have a man-made or natural disaster, again, having a good, robust, well-financed, well-resourced trauma center at Nashville General Hospital is a community benefit. It benefits us all.
To speak back a little bit to, you referenced President Obama and the new Congress possibly passing some health care reform. One of our members of Congress here in Tennessee was recently quoted saying that health care is a privilege and not a right. Can you speak a little bit to what type of health care reform you would love to see, and you know, what specifically, how you think that that kind of health care reform would affect Nashville?
Well, my first reaction is, with all due respect to our learned member of Congress, I would disagree with that. I think in the strongest, greatest nation on earth, with the most imaginative and hardworking citizens, that as a nation we have to value health. If you don't have health, you don't have prosperity, you don't have economic development. So to the extent that we can ensure that every American has some level of basic access to basic health services, from immunizations to chemotherapy, that makes us better as a nation. So my view is that as a government, as a federal government, as a state government, as a local government, we have a moral obligation. Doesn't matter whether you're Republican, Democrat, whatever. We have a moral obligation to provide some level of health care services or access to health care services. So I'm hopeful now, with the focus at the federal level with the new administration, President Obama and the new Congress, that we really do get health care reform done. And you say, well, why should it get done at all? Well, the economic reality is closing in on us. If we don't do something about health care, health care now takes up almost 17% of GDP. It's projected to go 25%, 30% of GDP if we don't make some structural reforms. And so whether you're liberal, Democrat, moderate, or whatever, you know, the economics aren't going to change. We have to do something better. We know we have a lot of resources in this country. We have the best medical care in the world, but it doesn't reach everybody, and that's a problem.